Welcome to Movement Disorder Examination. The examination for movement disorder are started by observing the patient as he enters the examination room. Observe the facial expression of the patient, the gesture, the eye blink of the patient. And when you engage the patient into natural conversation, observe the volume of the voice, the tone, the rhythm and clarity, and the prosody. At rest, ask the patient to place the hands on the thighs mid-pronation. Observe whether there is a spontaneous movement like tremor or fidgeting. You can continue with asking the patient to hold the arms in front of the chest for a few seconds. And outreach them. Observe for a few seconds whether there is abnormal posture, postural tremor, re-emergence tremor, or dystonic abnormality. Check whether the abnormality is present symmetrically or not. You can change the position in several directions and observe them in few seconds. We shall continue with finger-to-nose test. We can ask the patient to reach and touch his nose and your finger. Make sure that the distance is enough, about 1 arm length, and observe whether there is a dysmetria, whether it is undershooting or overshooting, intention tremor, kinetic tremor. Fixed target position is done for Parkinson patient, and if you suspect ataxia, you could explore this test with moving target test. Tapping examination is started by doing the most sensitive parts, which is the finger tapping. Ask the patient to do it as big and as fast as the patient can. Observe the amplitude and the frequency and whether it is symmetry between both sides. You could continue with the lower extremity, foot tapping, heel tapping. Do the task one side, and you could continue with the other side. 10 repetitions are usually enough to see the abnormalities. You could also continue with open and closed hand and supination and pronation hand movements. Compare right side with the left side. Muscle tone is examined by placing the limb in relaxed yet well-supported position. Check one side first, and you can ask the patient to do Roman maneuver by doing repetitive movement on the other side. This maneuver will augment the reaction, so you can feel the more obvious rigidity. Rigidity is found more obvious in distal part like ankle and wrist joint. Ocular rigidity is found in Parkinson's disease with tremor. For lower extremity, compare the result between the right and left side. For PSP patient, you can also check the neck rigidity. Gait examination is done by asking the patient to walk about 3 meters. Observe wide base length, stride and arm swing. Observe whether all of these present symmetrically. For balance, ask the patient to raise from chair with arm crossed on the chest. Observe the difficulty of initiation of movement, the stoop rigid posture, and the patient should be able to stand steady and walk without difficulty, and observe when the patient make a turn whether the head, the neck, body and extremity are in one line or in a unit. Check whether there is a shuffling, fascination of Gait or freezing. In pull test, first you describe the examination and explain to the patient the purpose of the test. You stand behind the patient in front of a wall to make sure that you can handle any accident that might happen. Hold the patient, and the patient should be able to correct any unsteadiness. We also have to do tandem test. Ask the patient to walk in a straight line, placing the heel of one foot directly in front of the toes of the other foot so that they are touching with every step. Make about 10 steps and ask the patient to turn around. Try to keep the eyes fixed ahead. Sometimes you also have to give cognitive load to the patient while the patient do the tandem test. For praxis examination, you could ask the patient to do simple tasks like brushing the teeth or combing the hair. For the eye examination, like slow pursuit movement, you can ask the patient to hold the chin to prevent head movements. Ask the patient to follow your finger or an object a slow movement about 20 to 30 degrees per second. Observe if the eye could track the object smoothly without jerking. Do the examination in horizontal and vertical plane. For saccadic eye movement, change the eye focus from two different objects rapidly. Do the examination in horizontal and vertical plane. Thank you.